explore symptoms that may be indicative of underlying cancer. These must not be ignored, either in yourself or your loved one. So let's move on. There might be some general symptoms present with any type of cancer, and these are loss of weight, appetite, and tiredness for no good reason. Moving on to the actual organs or sites. Lung cancer, a cough greater than 3 weeks, chest infection that doesn't improve, bringing up blood with cough, or pain in the chest area may be indicative of lung cancer. Mouth and throat, a new ulcer forming and not healing, a lump appearing in the area, taste of blood or actual bleeding from the mouth and throat area, sore voice, sore throat that doesn't improve over time, pain in the neck area, earache, changes in taste, hearing or smell, hoarseness of voice that doesn't improve over time, and food sticking. These are different symptoms but may be indicative of problems in the mouth throat area. Gullet and esophagus. The typical symptom for esophageal cancer is difficulty in swallowing, and the food tends to stick, and the sticking of the food is typically behind the breastbone. This may be associated with pain, and sometimes patients do bring up blood. Stomach cancers in the beginning typically present with symptoms that are very difficult to tell apart from an ulcer. Patients may bring up blood, and as the stomach cancer progresses, there may be other symptoms such as loss of weight, appetite, and tiredness. Only a smaller proportion of patients with pancreatic cancer are diagnosed early. They typically present with jaundice as the first sign. That is when the cancer is near the bowel tube and tends to obstruct it, and hence jaundice ensues. In other patients, or in general, pancreatic cancer presents quite late, and only a small proportion actually get treated as a result. The symptoms are also vague, such as dyspepsia, abdominal discomfort, pain, nausea, weight loss for no good reason, new onset of diabetes, and in those who were already diabetic, the diabetes getting worse. Typically, patients also complain of diarrhea, and the diarrhea is of the type that is difficult to flush away, is pale in color, and is foul smelling. Patients would visit their general practitioners at least 3 to 5 times before they are referred for specialist treatment. Colon cancer, change of bowel habit, constipation alternating with diarrhea, passing blood in the stool or stool and mucus, having a feeling of not emptying their bowels completely, that's tenesmus. Skin mole, so I'm talking about melanoma, and A, B, C, D, E mean the A is asymmetry, so let's look at this cartoon of a mole, and it's asymmetric. The borders are not regular, the borders are irregular. The color, there are several colors usually within the same mole, and the diameter, it's just about half an inch or a bit smaller, but usually not smaller than that. And finally, E means that evolution, so it tends to change over time. Any of these present in a mole ought to be highlighted to the doctor as soon as. Kidney is higher up in the belly, and a cancer of the kidney causes backache and blood in the urine. A bladder would cause bladder cancer will also cause blood in the urine. So blood in the urine is a dangerous symptom and must be reported as soon as possible. There might be repeated infections of the bladder or of the urine, and infections that are difficult to treat, or the inability to pass urine, or the converse, where patients cannot hold their urine and have to go very, very frequently. Prostate. The prostate cancer symptoms are difficult to tell apart from prostatic symptoms of benign origin, such as wanting to urinate, having to wait until the urine comes out, having to force the urine out, blood in the urine, or blood in the semen, or pain. These ought to be reported. Testicular cancer typically appears in 2 age brackets: the younger, late teenagers, as a lump, or a lump that becomes painful, or in older adults 45 years and older. And any change in the consistency of testicles and a new lump appearing is suspicious. Now we specifically look at cancer symptoms in women. So the general symptoms are much the same of tiredness, weight loss, and loss of appetite that might happen with any cancer type. Specifically in women, breast cancer appears as a lump, or even if it's not a definitive lump, it might be changing the consistency of the breast. Inversion of the nipple, or being pulled to one side, or changing its shape, or changing the skin around the nipple and looking more inflamed, or changing the skin such as dimpling may be indicative of breast cancer. Breast pain that doesn't go away specifically on one side ought to be investigated. Uterine cancer presents as heavy bleeding or bleeding after menopause. The pain typically is described as heaviness, lower abdominal pain, pelvic pain, or backache. And there may be watery discharge or discharge mixed with blood, sometimes foul smelling. Cervical cancer typically presents with bleeding during or after sex, bleeding in between periods, or bleeding after the menopause. There might be associated discharge. There may be pain lower down in the pelvis, back pain. Ovarian cancers are not easy to diagnose because the symptoms are typically not specific, and there may be a long delay before these are reported to the doctor. So fullness lower down, abdominal distension, fullness after a meal, feeling nauseous afterwards, distension of the abdomen for no good reason, increase in urination, or diarrhea alternating with constipation, or increasing constipation. And pain can be of the three varieties: pelvic pain, lower abdominal pain, and backache. And of course these ovarian cancers in general also appear with symptoms such as weight loss, loss of appetite, and tiredness. So this brings to the end a very brief description of the general cancer types and their symptoms. If you recognize any of these, please do report these to the doctor and have these investigated. Good luck and thank you.